So, if a patient presents with signs and symptoms of anemia and has low hemoglobin and hematocrit, we want to check that mean corpuscular volume. If it's less than 80, then the patient has a microcytic anemia, which is typically iron deficiency. If it's 80 to 100, they have a normocytic anemia, which is usually acute blood loss, malignancy, chronic kidney disease, bone marrow failure, or hemolysis. And if it's greater than 100, it's characterized as a macrocytic anemia, so vitamin B12 or folate deficiency. This is a general algorithm for anemia diagnosis. I would star this slide. So essentially, once you evaluate a patient's MCV, if it's high and they have a normal B12 but decreased folate level, then they have folic acid deficiency. If their B12 level is decreased but they have a normal folate level, then they have vitamin B12 deficiency, etc. You can really follow this algorithm to diagnose anemia. Moving on to iron deficiency anemia, it's the most common nutritional deficiency in the US. There's some things to know is that dietary iron comes in two forms, heme and non-heme iron. Non-heme iron is less readily absorbed because it's affected by gastric pH and other foods. And then phytate and polyphenol containing foods decrease absorption, which is why those that are vegetarian or vegan, they're more likely to consume foods with a less absorbable form of iron, along with foods that decrease iron absorption, which is why you can see iron deficiency anemia in those populations. Heme iron can be found in meat, fish, and poultry. Non-heme iron can be found in vegetables, fruits, dried beans, nuts, grain products, and dietary supplements. And then I have a little table here that goes more into depth on iron dietary requirements. And these are just some common causes of iron deficiency. So an inadequate dietary intake, like I mentioned previously, those iron poor diets, or it could be disease related, blood loss, so a hemorrhage, heavy menstruation, it could be drug induced, increased iron requirements. So for example, in pregnancy, pregnant women, they are usually required to have a higher intake of iron, and infants and adolescents because they're going through rapid growth phases. And then we have decreased iron absorption because of things such as an increased gastric pH due to PPIs or irritable bowel disease, etc.